Are you guys ready? Good afternoon, Cincinnati. Good afternoon, Cincinnati. This is not an armed robbery. This is me showing Cincinnatians one option among many to wear masks. As you probably can see, this is an FCC scarf, and we hope that soccer and the Reds and the Bengals and Xavier and UC and everybody else comes back soon. So I am going to take it off for now. But while we're having some fun with it, I am asking that people wear homemade cloth masks, or if you're lucky enough to have some medical masks, not the N95 masks. N95 masks we need for our first responders and for our healthcare workers. And while these masks are not as good as N95 masks or medical masks, they are better than nothing. And especially if you're going to Kroger or if you're going to Walgreens or wherever, think about it, and for a number of reasons. But what the studies show is that the mask gives you a little bit of protection, but not much. What it really does is protect others from you. And I want you to think about that for a second, because what we're learning is that many people have the coronavirus and will never know it and don't have symptoms, and yet can give the coronavirus to other people. And so think about the grocer at Kroger, think about the retailer at Walgreens or at Burn-In's Pharmacy or at Hart Pharmacy or the many other pharmacies in this city, and keeping them safe just as you want them to keep you safe. So, and obviously if you have something like a Reds or a Bengals or an FCC scarf, it'd be fun to show the Cincinnati pride as well. And so with that, I'd like to turn it over to Health Commissioner Melba Moore for our daily update.
Good afternoon, Cincinnati, and thank you so much, Mayor Cranley. This afternoon, we have 134 confirmed cases of COVID-19. That's a total of 14 that we've received today. We have 5 females and 4 males. I'm sorry, 9 females and 4 males. We'll be providing the ethnicity hopefully by Thursday, because we are going back through all of our cases to provide that to the community to keep you abreast of what the ethnicity breakdown is as well. We know that in our health centers, we have 53 patients who have tested. 10 are positives, 5 females, 5 males. Age range, 31 to 62 years of age. 40 tests were returned as negative, and 3 results are pending. And the age range that we're showing for all of our cases is averaging about 48.5 years. We've had, unfortunately, 3 deaths. We currently have 15 hospitalizations, and 32 individuals have recovered. As it relates to our state numbers, we know that in the state of Ohio, we have 5,148 confirmed cases. 472 are the number of ICU admissions, 1,495 hospitalizations, and unfortunately, again, 193 deaths. We know that the gender breakdown is 48% male and 52% female. Age range less than 1 to 101, with a median age of 54. Cincinnati, I want to just share with you, and I've heard the mayor and the governor both say it. These are challenging times for us. They're turbulent times. Hard decisions are having to be made. And the restrictions that have been put in place is not to be punitive to any ethnic group. It is so that we can save lives. Because what we know, this disease is spread, and as you just heard the mayor say, you might be infectious and not know it. So it's very important that you, if you must be out, to exercise, to get your exercise in, to practice physical distance. We want you to stay socially connected. I can't imagine how challenging this is to have a grandparent in a long-term care facility and you're not able to visit them. That rule is in place to protect those individuals. Please work with us so that we can continue to flatten the curve. Because as I look across this country and I look at the numbers of deaths and the number of people that have been impacted, our numbers are less. And what we're bracing for is this storm that's coming, and that's that surge. We want to continue to have fewer numbers, but help us get through this. And again, our mayor and our governor, they have stood up and have provided strong, steady leadership. And I'm thankful that I'm serving under this mayor's leadership. Thank you.
Thank you, Commissioner Moore. A couple things I want to talk about today. One is the issues around yard waste, and to clean up some information that I put out on Monday. I announced that our traditional yard waste collection will start June 1st. I also announced some alternative sites that people can drop off yard waste. First, while general yard waste collection is being delayed for now, if you want to, you can put yard waste in your trash can that is picked up, the city-issued trash can, if you have room for it. And it will be collected along with other trash, which obviously isn't the most ideal outcome for the environment, but it was done for many years before we improved our collection. But we understand that many of you are doing yard waste, and I give you permission to do that if that is your best option in the short term. I have also asked the city manager and the Department of Public Services to try to come up with some other options, and encouraging folks to put as much in the garbage can as they can without hurting themselves. We know this is a major inconvenience. We're sorry. This is exactly the kind of service that we want to provide, and is one of the many impacts that this virus is causing for us financially and in spacing out our workers. We were also informed after our announcement on Monday that the Rumpke Yard Waste site in Colerain Township is only free on Saturdays and Sundays, which is obviously an important caveat. So if you decide to take your yard waste to a yard waste dumping site in Colerain, and there's another one in Anderson, please check with the website and make sure that in fact it is the right time and location. And what we are being told is that it is only a free drop-off opportunity on Saturdays and Sundays. So to clarify, if your yard waste fits in your trash can, you can put it there and it will be dumped. You can also take your yard waste to Rumpke on Struble Road and Coleraine Avenue in Coleraine, 11:30 to 5 on Saturdays and Sundays. And Monday through Friday, 7:30 to 5, and Saturday, Sunday, 11:30 to 5 at Bazak Landscaping in 3295 Turpin Lane off Route 32 in Anderson. For more information, and we definitely recommend calling and checking the website out first, so we don't give you the unintentionally the wrong information like we might have on Monday, call 946-7766. Honoring frontline workers, we want to thank the Cincinnati Archdiocese for having a Mass for first responders this morning that was streamed online. Tomorrow, the Duke Energy Convention Center, Fountain Square, and other buildings around downtown will be lit blue in honor of our frontline workers, such as garbage collectors, healthcare workers, grocery workers, firefighters, and police officers. We know that they are sacrificing and putting themselves at risk to do what needs to be done to protect the rest of us, and we thank them for that. Did you have an update? Oh, you don't? Okay. Also, a few things on our senior facilities. We continue to be asked questions about senior living and care facilities in the city and how they're being handled since there is limited access to them. I am proud of the city's Office on Aging and Accessibility and the Cincinnati Health Department, who have been working with local senior care facilities for the last several weeks to ensure they are adhering to state orders and health recommendations. This includes enforcing visitation restrictions, sadly, but importantly, checking staff and residents for symptoms, and practicing increased sanitation to reduce risk of spread. The Office of Aging and Accessibility of the city and the Cincinnati's Health Department surveyed 24 long-term health care facilities in the city to assess their ability to comply with the state and federal regs, including sanitization, staffing, visitation, limits on congregating, checking wellness staff and residents. The needs of the facilities were also surveyed. We were able to give them advice on PPEs and connecting with the Hamilton County Emergency Medical Management when appropriate. We know some of the restrictions can be difficult on members of this community. Residents of these facilities are essentially cut off from their family members and friends. Isolation and depression are also real threats. Thankfully, through technology, we can set up video chatting between loved ones. The city recently partnered with United Way and the Greater Cincinnati Foundation and TCC Gives to provide tablets to 20 in-need senior facilities that house over 1,500 seniors. Last weekend, the Cincinnati Health Department requested to the Ohio Department of Health to notify all licensed nursing homes employees of their eligibility to receive benefits if they must stay home due to symptoms. I also want to take this opportunity to thank our great sign interpreters, Carolyn Browning, Jack Baker, and of course, Sarah Bianco standing next to me, who is doing a spectacular job. And we very much appreciate these services. With that, I'll open it up to questions. Do we have a question from the Business Courier?
Not today, Mayor. Thank you.
Welcome. Any questions from the Cincinnati Enquirer?
Yes, Mr. Mayor, we have two today. Thank you for taking them. We wanted to ask if there have been any COVID-19 cases reported from those either living or working in nursing homes or assisted living facilities in Cincinnati.
Commissioner Moore will answer that question.
Thanks, Max. Yes, there have been 8 cases reported, and we're going back through now to solidify whether or not those were patients and or employees. But yes, we're tracking that, and there were 8.
Thank you. And can you identify the facilities in question? It came up today from DeWine's conference. Dr. Amy Acton said that local health departments should be able to ID nursing homes. Is that something Cincinnati can do?
I can get you that information, but I don't have it in front of me
much.
right now. Sure. And I think you had another question?
We had one other, I think you addressed it earlier, Melba. It was regarding the cases by race. You said that will
Yes.
be released on Thursday?
Yes, we're going to try and have that ready by Thursday. Thank you.
Great.
Thank you. Question from Channel 5 WLWT.
Yeah, hi, Mr. Mayor. I have a few questions for you today. First one has to do with enforcing the stay-at-home order and social distancing rules. I know you talked about blocking certain highly populated areas off, making them harder to access. And I was just wondering if that's worked so far, and roughly how many of those warning tickets that you've mentioned have you given out to people who aren't abiding by the rules, if you do happen to have a number?
I don't think we have a number like that, do we? Yeah, just to be clear, I don't know how many tickets, warning tickets we're handing out. I think it's, yeah, we just, our officers just politely ask people to disperse when they're clearly congregating closer than 6 feet together who are non-family members. Yeah, and they're just
Okay.
warnings. They're not actual written tickets.
Okay. Well, secondly, I was just wondering, Cincinnati area grocery stores and hardware stores, how are they abiding, following those new guidelines by the governor, limiting the number of people in a store at a time based on what you're seeing? Or do they seem to be complying? Any issues with that you're seeing?
Not me personally. What I have noticed overall is great compliance. I've noticed in the stores that I've been in that there are X marks the spot in line, 6 feet apart at least. I'm not, obviously, I haven't been to every store in the city that's still open, but, and as I mention every day, I'm very, very proud of the incredible compliance that we've seen throughout the city. But it also is indicative of enormous economic costs. And, we're all hopeful that sometime soon we can be past this and start to go back to work and reduce the economic injuries that have occurred.
And last question, a lot of cities around the country are allowing healthcare workers to give out the addresses of people who tested positive for COVID-19 to law enforcement. The argument, obviously, is that this helps first responders stay safe, while others believe it's a privacy infringement. I think this is a conversation going on in other areas in greater Cincinnati as well, but was just wondering your thoughts on that, and if the city plans on doing anything like that in the future.
I'm going to have City Manager Patrick Dehaney answer that question.
Here at the city, the practice that we're doing is in compliance with federal law, and basically it's those who need to know as it relates to enforcing any kind of quarantines or to prevent community spread at the city. The health department, the police department, the fire department need to know that information, so they have that information.
Okay, question from WVXU.
I have a question for the health commissioner, if I might. I was curious, the tests that are being done now at the city health clinics, are those tests still being sent to an outside provider? And what's the turnaround time on that now? Has it improved?
Thank you for the question. Yes, we are still sending, because that's our vendor. It's still taking greater than 4 days to receive those test results back. And our vendor has assured us that they're working as quickly as possible to get those results back to us. So yes, and individuals who are getting tested are meeting the case definition for being tested, meaning that they're asymptomatic. Thank you.
Just a follow-up, has there been any thought to allowing the Ohio Department of Health to do those tests?
Yes, we have also reached out to the state, and we determined that the reagent that that the vendor was using was in alignment and compatible with what the state is using. So we've been sending, as best that we can, sending them forward to the state as well as to our vendor to speed up that process.
Okay, any other questions? All right, if not, then just as a reminder, tomorrow we will be lighting up the Cincinnati sign and Fountain Square and other locations, and if you happen to have a building and can control your lights in blue in honor of our first responders and to thank them for their wonderful work protecting us all. Thank you very much.